Revision rhinoplasty is very much an emotional roller coaster for the patient. I want to talk a little bit about Aryana's case. As a surgeon and as a revision rhinoplasty specialist, when I see a nose that has a lot wrong with it, I actually get excited by the opportunity to correct all those things. I can never guarantee a perfect result. I can never guarantee a perfect airway, but I always itemize in my head, okay, what are the most important things for this particular revision rhinoplasty that we really have to get right? Airway is always at the top of the list for patients that are suffering from breathing issues because their quality of life has been affected, and most of the time there are some cosmetic concerns that go along with it. Then we go down the list. For Aryana, airway was obviously the most important thing, but her nose had no support, it was drooping, it was crooked, her nostrils were very different. So we actually did end up using a rib graft to reconstruct her nose. I really had to rebuild her entire tip. I had to replace her entire front part of her cartilage because it was so crooked, it was unusable. We call this an anterior septal reconstruction, which is a technique that revision rhinoplasty specialists are ready to deploy at any time necessary. I used an endoscope to really visualize everything within Aryana's nose to make sure that everything was set just right. The rib graft was really useful because we needed strong, straight pieces of cartilage to straighten her nose and to rebuild her tip. Lastly, I did need to rebuild her nostrils because her nostrils collapsed with inspiration, so I was able to do that again with strong pieces of cartilage. Aryana's surgery was very complex. It took, I believe, nearly 5 hours to perform, but everything went really, really well. I was surprised by some of the things that I saw under her nose, but fortunately, they were all things that I had accounted for and had planned for. Her outcome so far is exactly as we had expected. She's very pleased, as you'll see in her reveal videos, and I couldn't be more pleased for her early healing results.
Yay! I think we have another hit on our hands. What do you think?